Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. But that's not all we talk about. Every now and then we go off topic, and today we're going to do that with my good buddy, Dr. Mike Simpson. We're going to talk about Jiu-Jitsu, specifically Brazilian Jiu-Jitsu, and Brazilian Jiu-Jitsu over the age of 50, because we are both now over the age of 50, right?
Well,
So,
hello.
Dr. Simpson, for those of you guys who don't remember, is an exceptional individual. So, Army Ranger, Green Beret, enlisted up to E7. Is that right?
That's correct.
Yeah, and then that wasn't enough for you, so you decided to go to medical school. We actually went to the same medical school, but not together. Believe it or not, you're older than me by how many years? 5?
Uh, no, you're how old?
I'm 50.
I turned 58 next month.
Wow, okay. But I actually graduated from medical school before
Yes,
you
you
did
did.
because you were off doing cool Army stuff.
Yeah, I was screwing around. I
Yeah,
was playing with explosives and machine guns. I
yeah,
should have been.
yeah. And I was studying at the chemistry lab in college. So we went to the same med school, but we're off by just a few years. But we met up in residency, and we did our emergency medicine residency together. And that's where I think that's where your jujitsu journey started. Is that right? In San Antonio?
Yeah, first time I put on a jiu-jitsu gi was during residency,
Yeah.
and it was actually a borrowed judo gi.
Oh, is that right? Is
Yeah,
that
the
right?
old school with the little
Yeah.
apron back and everything.
Now, I'd like to take a small amount of credit for you getting into jujitsu.
Oh, you most
Just a
definitely.
small amount.
Yeah.
Yeah.
Yeah. It's well, you were the only person in residency, not just in our class, but in the whole residency, who rolled.
Yeah.
And so that was something I was able to kind of identify from the things that you talked about early on. And I think I kind of during intern orientation, I think I kind of skittishly approached you about, hey, this is something I would definitely be interested in. So and you located a school and you endorsed it, and we all ended up taking lessons there, somewhat off and on, because obviously we didn't have a whole lot of time.
It was, yeah. Yeah. It was definitely, we probably, what do you think? Maybe 2 times a week, 3, depending on the rotation we were on at the
Yeah,
most.
kind of at most. I was
Yeah.
actually when I rotated in Austin, because the very first time I ever stepped on the mat was actually not at Maha's. It was actually at Phil Cardelia's old place,
Oh, yeah.
right? Who was a Helson black belt
Nelson, yeah.
in South Austin. That school is still there. Somebody else has it now, but
Okay.
that school is still there.
Yeah.
And I was going to the 6 a.m. class there,
Hmm.
or it might have even been like a 5 a.m. It was still dark.
Yeah.
And I went like every day for a week, and I'm like,
Nice.
wow, this shit's awesome. I have
Yeah.
no idea what I'm doing, but I know I like it.
Yeah.
And I remember you and I went to, and Helson came to town. And
I
you went to
remember we went to a
a
seminar.
seminar. Yeah,
Yeah.
and I still to this day remember it was Turtle Guard.
That's
It was
right.
it was a,
That's right.
it was a seminar centered on Turtle Guard, which I now hate,
Yeah.
and I hate Turtle Guard with a passion,
Yeah, I do too.
uh, because it's a great sport jujitsu defensive position, a terrible street fight.
You'll get soccer kicked in the head for sure.
Exactly.
Yeah.
Yeah. Oh,
Absolutely.
and finally, after all these years, I finally learned, because it to me that we're getting ahead of ourselves here, but to me, when my opponent is in turtle guard, that was always kind of a Gordian knot to me.
Hmm.
None of the traditional turtle guard attacks ever seemed to work for me.
Yeah.
And then 3 weeks ago, I learned an old wrestling attack for it.
Yeah.
And you probably know exactly what I'm talking about. And that's all I use now.
Yeah.
And it's very high percentage.
Yeah. I picked up some like catch wrestling stuff that I use to untie that knot. Because you're right, some guys are really, that's their thing, and they button up, and they're just like a little turtle, and they're not giving you anything. So you got to find a way to kind of open that a little bit, and that's a huge challenge. But yeah, we started training. It was at Mahasinki Jiu-Jitsu, Sergio Correa. Check it out, guys, if you're in San Antonio. It's one of the best places in all of southern Texas. And Maha's a good guy.
Yeah, he just gave a seminar somewhere in South Texas. I still
Oh, did he? Okay.
Yeah,
Yeah.
so he's extremely active. So and a high level jujitsu.
Oh, yeah.
Uh,
Yeah, yeah.
I think he's so humble and isn't a big showy social media guy. I think people
Yeah.
don't realize how high level he is.
Oh yeah.
Yeah.
Well, he would fight at 148. He was still he was 48 or 49 when you and I were there. And for the listeners, this is in 2006. So we were there from '06 to '09, and he was still fighting. He had his last professional MMA fight while I was there, which he won in like 45 seconds via triangle choke. I don't think he threw one punch in that. Yeah, maybe a jab, but
No,
he just took the kid down
I
and
don't.
triangled him.
He does not know how to strike.
Well, he doesn't, he doesn't need to.
He doesn't need to.
Yeah.
Yeah.
But, I showed up at that gym. I had been powerlifting for years. I was a state record holder in the deadlift and at 250 pounds. And, Maha put me to sleep multiple times or near put me to sleep multiple times with ease at 148 pounds. So that was, one of the things that made me fall in love with jiu-jitsu because I was like, this art is amazing. Here's this guy that I outweigh. I have 100 pounds on him. Literally 100 pounds, and it wasn't fat. And he was just ragdolling me, making me look stupid. So it was pretty cool.
Yeah.
Yeah, it was absolutely awesome. But now, so yeah, we stuck it out there for those 3 years during residency, and for people who don't know what residency work hours are like, they're long, and they're pretty grueling. And you throw into that, we did shift work, obviously, and we still do as ER physicians. So that means, you might start work at 3 in the afternoon and finish at 3 in the morning. So not only are you working tons of hours, but your circadian rhythm is off. So did you have any tricks for dealing with that and staying fit and in the gym during those years?
Well, and you'll probably remember this is intern year. In intern year, I ballooned up.
You did. You gained some weight. Yeah.
I gained 35 pounds or
Yeah.
something ridiculous.
Yeah.
I got probably as close to 200 pounds, I think, as
Yeah.
I've ever been.
But that's not uncommon, right? I mean,
No, because I gained weight in med school,
yeah.
but then I recognized it in med school. And towards the end of fourth year, I deliberately set up rotations where I knew I was going to have the ability to work out. And I was really, really diligent about working out. I probably put on, I don't know, maybe 15 pounds in med school.
Mhm.
I lost most of it before graduation.
Yeah.
Didn't have any problem fitting into my dress blues on graduation day. Felt pretty healthy when we showed up. But then, between the shift work, going from a day shift, work a couple of day shifts on Monday and Tuesday, and then Wednesday. Now I'm on an evening shift, a stretch of evening shifts. Combine that with coming in for a grand rounds day where you got to be there.
I remember that. That was brutal.
You got to be there at 7 to noon.
Yeah.
And then you got to kind of kill time until 3 o'clock in the afternoon to go to your evening shift.
Yeah.
And the longest I ever went in residency without a legitimate day off because I kept getting screwed that my day off.
Yeah.
We used to call the DOMA.
The DOMA.
Day off my ass.
Right.
On Grand Rounds Day.
Yeah.
I went 68 straight days once.
Yep.
Without a day off.
Yep. Yeah, I had a stretch like that too.
Yeah, and it was brutal.
It's brutal.
And night just killed me.
Mm-hmm.
I could never seem to sleep during the day. Eventually I was able to get a prescription for some Ambien, which was the only thing that got me through. And then Ambien screwed me up for years. But I ballooned up, and it really wasn't until it was actually I was on an away rotation. I was up here in Austin doing. I think it was either my the PEDS rotation or maybe it was my EMS rotation. Then I'm like, all right, I'm going to get serious. I'm going to clean up my diet. I was working out in that rickety hotel gym or apartment complex.
Yeah, I remember that.
South Congress Street.
That's right.
And I was going to jiu-jitsu, but I was being really diligent, and I actually managed for about over 90 days, and that was when you put me on a low carb diet.
Yeah.
So
Yeah.
I was on a ketogenic diet, and I lost all the weight.
Yeah, you dumped it quick too.
Yeah, and I was rolling, and I felt good, and I kind of got myself back.
Yeah.
But honestly, I remember I had to go in for resident counseling during that time, and I remember my staff mentor was John Rayfield, and John asked me, he said, "Are you keeping up with your reading?" And I said, "No, I'm absolutely not, because my health got so bad, I'm only concentrating on my health right now." Right. And I didn't have time to read.
And what's he going to say to that?
Yeah, he was like, "Yeah, you got to, do what you got to do. Do it, just recognize that the bill's going to come due for that someday." And I said, "Yeah, the bill for my health is going to come due."
Yeah, right. Someday. Exactly. Yeah, it's not going to be. Yeah, you got to pick your battles sometimes. So, well, I was, like I said, I think if we had to look at the entire 3 years, I felt like I probably averaged. There were certainly times when it was better, but I probably averaged 2, maybe 3 classes per week. And that's one of the excuses.
That's really good.
I was pretty dedicated, and even during our like surgical ICU weeks and months, I really now my roles were not good, but at least I was there. My mind was in it. But that's one of the excuses I hear, and you probably do too. Is this, I don't have time to learn jiu-jitsu, right. And granted, you and I both started jiu-jitsu as full-grown adults with military careers. Oh, and by the way, you're going through a medical emergency medicine residency. So, if we could do it, I think anybody can do it. The young kids that come to my gym now, I never had the opportunity to train 5 days a week, twice a day. Mm-hmm. I never had that kind of a schedule. But I also started late, just like you. I mean, I was 35 when I started. You were 40. So, at 35, I was still pretty athletic. I could still hang with the 20-year-olds. Those days are gone now. But even at 35 and as I got older into 40, I mean, the thought of training hard jiu-jitsu 5 days a week, twice a day, it's just not an option for me. Like that, I would be physically broken. And I did have injuries. We can talk about our injuries because you and I have both been under the surgeon's knife.
Yes, we have.
You more recently than I have, but
and I'll be going back under again soon.
Oh yeah. So we can talk about that. But what do you say to that? To guys that say they don't have time?
Yeah, I mean, if you have time, and I've talked about this multiple times on social media. I've talked about it on my podcast as well. That if first of all, okay, we won't even talk about other things. Let's just talk about only about jiu-jitsu. If you say you don't have time for jiu-jitsu, okay, newsflash: every jiu-jitsu gym has a morning class on a Saturday, or at least has an open mat.
Yeah.
At some point during the weekend, they have an open mat.
Yes.
Right.
Yeah.
And for those of you that don't know, so open mat means anybody can come in. There might not be somebody unlock the door, turn the lights on. There might not be a formal instruction for that day, but there's going to be a group of people there who are going to try some stuff out. They're going to roll with one another. They're going to do sparring. So that's one day a week that at least you could show up. And as a brand new jiu-jitsu, as a brand new white belt, you could approach a brown belt, black belt, purple belt, even a blue belt, and say, "Hey, I don't know jack shit. Show me the most basic thing. Learning, the basic things: how to shrimp, how to stand in base, how to escape the mount, right? How to pass the guard, how to do a couple of submissions from the guard." You can start laying the basic foundation. So that's one class a week that you can absolutely go to.
Absolutely.
And then pick one other night during the week that you can just, make some time to go to the 6 p.m., the 7 p.m. class, whatever. You can go to that class. So that's 2 days a week. And 2 days a week as a beginner, 2 days a week I consider to be pretty good.
You can make progress.
Yeah, it's definitely sustainable jiu-jitsu, and it is progress level jiu-jitsu to an extent, right? I'm one of those people that I got to do 3 days a week.
Yeah.
To really feel like that's where the switch
for me too, absolutely. But I will say what I did, on those long stretches where maybe I was only getting in twice a week. When I was on call in the ICU, guess what I was watching at 2 in the morning? I was watching jiu-jitsu instructional videos. So we get an admit. I'd go put in a central line, type up my note, and then I'd go back and watch some Mario Sperry, old school Mario Sperry DVDs, and which is what we had back then. So that you can almost get in a third class that way, at least mentally. And so I would watch these videos while I was on call, and then maybe pick a couple of those moves that I would drill on the subsequent actual class that I would go to. So there's ways to do it. Is it ideal? No. I mean, ideal would be to train 5 days a week, twice a day, but that's just not the cards, for all of us. So
yeah.
So after residency, we both went to our operational units. How were you? You probably, I know what you did, obviously. So you were probably with a bunch of guys that had all been training, I'm assuming.
Yeah, so I left residency. I went back to Fort Bragg, and I got assigned to JSOC.
Yeah.
And because of the unit that I was in, I had a real advantage because Greg Thompson, who is a hoist black belt, runs Team Rock in Fayetteville. He had at the time.
I know them.
Yeah. Greg was also the founder of the Special Operations Combatives program.
Right.
I went to Greg's school. I introduced myself to Greg. I said, "Hey, I'm assigned. I work behind the fence." I was told that you guys have a contract. He's like, "Absolutely, we've got a contract with your unit. You don't have to pay anything."
Awesome.
And I was doing two. My first year back at Bragg, I was doing jiu-jitsu twice a week and Muay Thai twice a week.
Nice.
Nice. Because I knew that my striking was just absolutely garbage.
Yeah.
And I wanted. I'm like, I need more tools in my toolkit. And I actually found out that I'm actually a little bit better. I kind of take to striking a little bit better than I do jiu-jitsu, probably because I have an ability to take a lot of punishment and kind of rope-a-dope wear out my opponent, which is not ideal. And and that was years ago. I wouldn't try that now because I don't think I'm as durable as I was then. But I was able to continue. And then one of the things that I did, you talk about watching videos, is I recognize that I'm getting smashed all the time. I'm getting stuck in positions all the time that I can't get out of. So I got an iPad and I downloaded the Roy Dean Blue Belt Essentials app, and I downloaded a bunch of Stephen Kesting sweep and escape videos.
Great stuff.
Like, you know what?
Great stuff.
My whole thought process was, until I make blue belt, I only care about getting people off of me.
Yeah.
I only care about because and honestly, if you're going to prioritize this from a self-defense situation, you don't need to be learning how to Ezekiel choke everybody or Kimura everybody. If you can get somebody off of you and get the hell out of there, you live to fight another day.
Exactly.
So that's my priority of work.
And in the type of unit that you're in, you're in a combat arms unit. You are deploying you're doing real combat deployments. So the jiu-jitsu that you have to be thinking about, and the jiu-jitsu that the guys that you're with are thinking about, there's not a lot of brim below an X guard being trained, I'm guessing, right? This is actually real combatives that you need to use on the battlefield in a real situation where, there are firearms involved, there's sharp, pointy objects involved. And so that kind of jiu-jitsu is a little bit different. And that's something that, and I don't want to get too far off tangent, but there is a lot of criticism in the jiu-jitsu community about things going too much in the sport direction. And I kind of agree with that.
I do too.
And we're losing some of the combatives, real world self-defense aspects of it, which really is what jiu-jitsu was intended for. So I don't know how do you feel about that, having been at a high operational unit, where this stuff actually is life and death.
Yeah, well, the best way that I can sum that up is with a couple of examples. The first example is the Modern Army Combatives Program, which was started by Matt Larson, a former Marine, former 275 Ranger, Brazilian Jiu-Jitsu black belt, I want to say, I think he's a Kempo black belt, Okinawan Kempo
I think you're right.
belt.
Yeah.
He's been on my show. He's got three black belts that I know of. And Matt said it best. He said, in a tactical situation, the person who wins the fight is either the person who either A, kills his opponent, or B, whoever's friends show up with guns first.
Yeah. I bet.
So if I'm in a close quarter battle situation and I'm engaging you, if my buddies make it into the room and I have kept you at bay for that,
you win.
30 seconds to 2 minutes, I won.
Right.
Because my buddies showed up with guns. Right. And to those who say, I get this all the time, especially, it's, in military and law enforcement, you should never go to ground. Well, I'm going to tell you, that's CQ. The way CQB, you're not going to have a boxing match or a Muay Thai match in the middle of CQB. It's very messy. You do end up putting your hands on people. And there were a lot of times, because here's the thing that people don't realize is, you're going out and doing operations at night. Very often, you're not going in there to kill everybody. You're going in there because there's somebody there who has information that you want.
Exactly.
Right. So you're going to have to put hands on them, and they might not like that. Right. They're going to resist.
Right.
You need to have some basic grappling skills because you need to get them down, get them to the ground, make sure they don't have any weapons on them. Do it in a manner that you are safe and they're still alive. You haven't cracked their skull open, so they're worthless to you, and you can get some flex cuffs on them, get a burlap sack over their head, and get them out of there. And it was on my very first deployment. I had to put hands on something.
Yeah. As the doctor, you're having to do that.
Right.
Right.
The way that it ended up was there were some people that needed a good talking to.
That's right.
So we rounded those people up, and without going into tremendous detail, it ended up that was my first night out. They knew it was my first night out, so they're like, "Hey, we don't want you doing anything too crazy your first night out. So would you mind being with this other guy? And as we bring these guys out, you're basically going to babysit these guys until we're ready to roll off target." I said, "Absolutely, I can do that." And one of the guys got a little squirrely, decided he didn't want to go along peacefully, managed to work his way out of his restraints, and wanted to go for a little jog. And so I had to have a little one-on-one with him, explain to him why that was not going to happen.
Right.
It got me a little street cred with the operators.
I'm sure it did.
For future operations, I was integrated on a little bit higher level, shall we say. So I've seen it firsthand, and I know several guys, that had a grappling and or MMA background prior to becoming operators that have used it. And I'll tell you one more thing that most people don't realize. You're gonna see people all the time that these martial arts guys can't even see their own black belt because their belly's so big.
Oh my God.
And they get like, "Well, I've trained special forces," and they'll say it in that exactly that way,
right?
Like a pack. So they got invited to do a 3-hour seminar in 1987.
Right.
The only person that has a long-term contract to train Tier 1 operators is Greg Thompson, who's a Brazilian Jiu-Jitsu black belt, who's SOC P. Right. If you go behind the fence and you go into the mat room, the person that's going to be training you in there is somebody who learned from Greg Thompson.
Right.
So unless you're training with a guy named Greg Thompson or somebody who knows who Greg Thompson is, you're not training high-level military combatives in the soft community.
Absolutely.
I don't care. I don't give a fuck what Paul Vunak says. I don't give a fuck what Tony Blauer says. Tony Blauer gave one seminar to one squadron years ago, and they're not using his curriculum. Same with Vunak. Vunak, the SEALs played around with Vunak's RAT system for 6 months, and then kicked it over to the side. You ask Jocko Willink, you ask Scotty Clark, who are Brazilian Jiu-Jitsu black belts, they'll tell you what the real deal is.
Yeah.
And that, most of these units are training. But to get back to your point, the sportification of Jiu-Jitsu, and the Gracies have talked about this.
Yeah.
It waters it down.
They do.
And it takes what it is.
Yeah. And, and that's not to take away from sport jiu-jitsu because it's fun. It's great. that's probably 90% of what I do when I roll is I'm just having a good time with my buddies. And yeah, we're doing things that I know if I was on in a street fight would probably get my face smashed in. So I know when I teach, I always try to bring everything back to that the possibility of real violence and teach moves that they may be sport moves, but they're also sort of dual purpose, and that they can very easily be modified to a street environment or to a more lethal environment if need be. And yeah, I think again, nothing to take. I'm not taking away from guys who just love to do sport jiu-jitsu because it is pretty cool,
No,
and I like it.
they're phenomenal athletes,
Yeah.
and I appreciate, and I love rolling with those guys.
Oh yeah. And those guys, I'm a black belt at this point, but these guys that are really good at sport jiu-jitsu, I mean, they hand me my hat, on a regular basis because they're doing a lot of this fancy octopus stuff that I don't do. I joke that I do caveman jiu-jitsu. I don't do anything invented after like 1978. But that's what works in real situations. It's not it's basically everything you learn up through blue belt. You don't need anything past that, in my opinion, if you just learn those solid fundamentals
literally
for real fighting.
If you watch the like I said, I mentioned the Roy Dean Blue Belt Essentials.
Mm-hmm.
You can get it as a DVD or you can download it as an app. If you only ever learned all those moves, but you did each of them, one of them 10,000 times, 90% of the people on this planet could.
Oh yeah, you'd be pretty dangerous. Yeah.
Yeah.
Yeah. Well, what you talked about with in the military, it spills over to our hospital work. The number of healthcare workers that get assaulted every year is unbelievable. The general public, I don't think, has any idea of how violent some of the patients are that come to the emergency room, especially these days. They're psychotic. So we have a massive mental health crisis in this country because we decided to treat all these people as outpatients many decades ago, which was a terrible idea. We just release them. It was a terrible idea not just for society but for the patients as well, because they're all homeless and suffering from all the effects of that. But then not only are they're mentally ill, but now we throw in methamphetamines in there and these other drugs, and people come in. I've been swung on multiple times in the ER, and I'm a big scary dude, but when there's meth on board and enough alcohol, they don't care. And so unfortunately, jiu-jitsu has been a part of my medical practice, and I know it has for you because I know the stories, and we don't have to go into the details, but having some basic.
You mean the time a staff physician walked in the room and I had a patient in a rear naked choke, and my first words were, "This is not what it looks like."
I wasn't going to bring that story up, but yes, that is what I'm talking about.
Hey, he punched one of my medics.
I know, and they
not happen.
That's just how it is.
He punched the female medic,
right?
They always 75 pounds.
The medics and the nurses always get the worst of it, generally. Yeah. But again, you got enough. If you're psychotic enough, or you have enough methamphetamines on board, you're just fighting whoever, and it's a dangerous place. And I feel like we shouldn't have. I shouldn't have to be security in my emergency department, but if you saw who our security guards were, you'd realize, guess who's security? It's me. And that's just another reason I think. I think every man. And I encourage women to train jiu-jitsu too, obviously, but every man needs to know how to defend themselves, at least to have some basic skills, I think, in some sort of hand-to-hand combat. And because, the fact is, like, you may say you're a non-violent person, but violence will find you. And you can be as careful as you want to be, but, the way the world is and the way that things are changing in our society, you can be just walking down the street with your family and be attacked by some lunatic.
And
and you just have to have some basic skills to handle that.
Yeah. My wife and I were fortunate one night. We were driving to go out to eat. We were at a stoplight, and we were behind another car, so we couldn't even run the stoplight to get away from this. there was a homeless guy pacing back and forth, obviously mentally ill, talking to himself.
Mm-hmm.
Something about us, he fixated on us, fixated on our car.
Yeah.
And he made a lunge for my wife's door, which thankfully was locked, so he couldn't get in. But that very easily could have escalated. Had we had a window down, had he broken a window, or had the door not been locked for whatever reason, that could have ended up in, we were just going out to get with, hey, let's go get a steak. We're definitely not planning on violence. I wasn't carrying, I have a license to carry. I wasn't carrying a weapon because we were going to a place that had a really good strawberry blonde beer that I was looking forward to drinking. And like I say, trouble found us.
Right.
And luckily nothing came of it, and the light changed. The person in front of us went, and we got the hell out of there. But it could have gone to.
Yeah, that's just how it is. And say you had been carrying, the fact that you know jiu-jitsu at a high level gives you that intermediate option. Because a guy who doesn't know how to fight, if he has a firearm, that's great, and he knows how to use it. That's fantastic. But now you go from nothing to lethal force, and there's nothing in between. And granted, I know you're in Texas, and that sort of thing is it probably is you probably have less issues in Texas that you would in another state if you had to shoot that guy. But I mean, there's still a lot of paperwork that you don't want to have to do. You'd much rather restrain that guy till the cops come, and not hurt him, and
And I don't, there's unlike the stereotype that gets perpetuated, I don't leave my house every day hoping.
No, that is the last thing you want to do is ever deploy your firearm. Absolutely.
I don't want to clear left.
No. Absolutely not.
And I've had a concealed carry permit since 1989, 90 time frame. I've cleared leather one time, and that was a crazy individual literally charging at me.
Right.
And I ended up not having to pull the trigger as soon as he saw.
Thank goodness.
He saw that. He had an attitude adjustment change, but I was fully, I didn't pull it out to show him and threaten him. I fully intended that because I thought the guy had a knife on him. He looked,
well, he very well could have, right?
Yeah, and it looked like all the boxes were ticked for mental illness and probably having and also looked like he might have had a number of diseases, and I didn't want
to. Yeah, that's the other thing. You don't want to get too close.
To the guys that carry who don't train, and I've had this conversation with people before. I say, that's all right. It's the only thing I need is Smith and Wesson. And I say, so you don't train any type of unarmed combatives at all?
Yeah.
And they say no, and I go, okay, so you're just somebody else's holster. That's what
right.
Because if I need a gun, I'll just take yours.
Well, that's the thing. I mean, you can ask any police officer, anybody in combat arms, that they will tell you just how quickly someone can close the distance on you, and then take you down to the ground. You don't even have a chance to deploy your firearm. They can be 20, 30 feet away, and you think that that's a long distance, but it's not. Somebody who's, especially a young athletic kid, can cross that distance in a heartbeat before you even have a time to pull it out of the holster. So
I've noticed, back, there was a period of time, as you know, that I worked for a company called Sheepdog Response.
Yeah.
And we would do training courses for civilians, and we would do training courses for law enforcement, and both grappling and shooting. And typically on the second day of combatives training, of the grappling training, we would introduce weapons. And we would give the students, and as instructors, we would never carry a weapon into any of the grappling matches.
Mm-hmm.
We would give the students the option: do you want a knife? Do you want a gun? You can have, I'm not going to have anything. You can have whatever you want.
Mm-hmm.
And I can say, and I was a blue belt at the time,
mm-hmm.
working for Sheepdog. I never got stabbed. I never got shot.
Right.
And
you probably took a lot of weapons away.
About 50% of the time, I got the weapon away from them, and the other 50% of the time, I used the way they were deploying the weapon to go right into some type of submission. Right. So they had one arm completely out of commission,
Yep.
which I was easily able to turn into a
Yeah.
straight arm bar, turn into an Americana, or just tie that up and do some other type of submission, or just generally make their life miserable and say, hey, this is the point where I would just elbow you into unconsciousness. Because I've noticed a lot of people that they would fight until they realized, all right, I'm out of tools, and I don't. They wouldn't disengage
Right.
and go for that weapon. They would go for the weapon in a panic.
Yeah.
And
Yeah.
I've already mounted you, and you're
Right.
doing your gun, right?
Yeah.
Or I've already, just one guy. I'll never forget this. I was kind of rolling, kind of lazy, wanted to see what he would do, and he was in my top half guard, and decided in my top half guard that he was going to draw, and I slapped one hand on to cover his hand.
Yeah.
Sat directly up, basically into a Kimura position, swept him.
Yep.
And then took the gun away from him.
Yeah.
Just because it was that easy. So I've noticed people that train unarmed combatives have an easier time transitioning to the weapons aspect than guys who are weapons, trying to integrate.
Which totally makes sense. If you're so weapons focused, but what a good experience for that guy. I'm sure the light bulb went off, and he thought, "Wow,
yeah,
like I just got killed. If that was real, I'm now dead." So, well, why don't we? We can go on about this stuff. Why don't we transition over to talking about what it's like to keep up with this kind of training when we're not quite as young as we used to be, right? Things, there are new challenges. What are your major injuries? Let's compare notes. I know most of them, I think.
Yeah. So I should qualify this by saying, according to the Veterans Administration, I'm 100% disabled.
Right.
I have 4 herniated discs, 2 in my neck, 2 in my lumbar spine. I have extreme scar tissue in both shoulders. Oddly enough, I have a disability rating for my right, but not for my left, and my left is actually worse. Pretty severe arthritis in both hands, especially my thumbs, which this is actually the most common place to get arthritis. People don't realize that, but
correct.
It's extremely common.
Yeah.
And I have it in both. I'm probably going to end up with surgery on this left hand here coming up in the next 6 months or so. My knees are pretty much shot. I have in jiu-jitsu, I've torn both MCLs, both PCLs. I don't know about my ACLs and LCLs, but probably, or my ACLs and PCLs, but definitely my LCLs and MCL. And of course, in May it'll be 2 years that I got a titanium right hip.
That's right.
So I got a total hip. And all of this means a certain level of adjustment in how I do things, how I approach things.
But that being said, you have an artificial hip. So I think people need to stop. We need to stop and appreciate that. You have an artificial hip, yet you are still, because I've seen the pictures on Instagram, you are still out there. You are still able to do jiu-jitsu. So
and I still box jump and squat.
And you box jump and squat, and that's a testament, I think, to 2 things. One is how good these hip replacements have gotten over the last few years, and they've really got this surgery down. But also to your baseline level of fitness that allows you to do that.
And that was one of the things that when I got it done is my surgeon, who's Dr. Robert Hansen III, MD, excellent orthopedic surgeon. He told me, he said, "You're going to be the youngest hip I've ever done." He said, "But the good news is," he said, "you're in great shape." He said, you don't have a lot of muscle atrophy. He's told me since, he said, "Sometimes I wake up at night wondering, is Mike on a jiu-jitsu mat somewhere with a dislocation?" Thus far, it hasn't happened because I continue to work out and stay strong. That's one of the factors into why I hopefully will never dislocate, because I keep the muscles around that joint conditioned, right? So it's really important. If you check out and you say, oh, I've got an artificial hip, I can't do anything anymore. You're kind of setting yourself up for failure.
Well,
So
it's a self-fulfilling prophecy, right?
it
Yeah.
absolutely is.
So
Absolutely.
that's a great like side point too. If any of you guys out there are, if you have a joint replacement in your future, 6 months, a year, you've been told you're going to need one. The single best thing you can do to get ready for that surgery is to get physically fit and get strong.
Yeah. And to work out, that's what I
That's it.
did leading up to my surgery is I was getting cortisone injections, continuing to squat, continuing to deadlift,
Yeah.
continuing to do lunges, and he even said to me, he said, it's this weird double-edged sword. He said, you are so active that it's increased the level of wear and tear, but at the same time, it's helped you. It's protected.
Mm-hmm.
So I tell people, don't try to, if they tell you, well, we can't do your surgery for 9 months, say, well, give me a cortisone shot so I can get 6 months of working out in to stabilize that joint as much as possible leading up to surgery.
Yeah. Yeah, and I'm probably a decade behind you. Both my knee and my hip need to be replaced. I've had an ACL, MCL. I've had a lower lumbar L5S1 fusion that failed. Full rotator cuff reconstruction here. I need one on the right, but that was such a horrible surgery that I don't think I'm going to do it. But shoulders are tough, and in all fairness, like with you two, I mean, these are not all from just jiu-jitsu. So I don't want to scare people away from trying jiu-jitsu because they think they're going to end up, being an orthopedic nightmare. I mean, you had 30 years in special operations. I did 17 years on active duty, and I was a competitive powerlifter for 10 years who did not know how to train light. And so, yeah, so there's a lot of background wear and tear there that you and I are both paying the price for. But the fact is, I mean, jiu-jitsu, I think if you stick with it to black belt, you would be lucky. I don't know any black belts that haven't had some sort of a joint or tendon surgery. Maybe you do, but everybody's had something done because it's
hard to think of one.
I can't think of one off the top of my head. I'm sure they're out there, but you're looking at
Jake Wadsworth is probably the healthiest black belt that I know of,
sure.
But it might just be because he's never told me what his injuries
are. Right. Yeah, but it's 10 to 15 years to get a black belt, and that's a long time. It's a long time on the mat, and it's a long time for accidents to happen. So now that we're older and wiser, I know I have some strategies that I use to try to prevent injuries. And this is the hard part is, you need to be on the mat to not just maintain proficiency, but also to get better. Because my goal is just to get a little bit better every single time I train. But it's also to not get hurt. And sometimes those two goals can be at odds. So what are the strategies that you use to stay in the game? You're nearly 60 years old. I've seen you out there. You're tapping guys.
It sounds terrible when you say it that way.
Sorry, buddy. This is the truth hurts.
It's true. It's true.
But do you look that age? No. Do you move like that on the mat? No. I've seen the photos and the videos of you training with guys in their 30s and you manhandling them. So what are your what's your approach to still doing jiu-jitsu, still improving, yet not getting injured?
Yeah. One thing I would have to say is I don't know. I think a 20-year-old, we talked about these sport jiu-jitsu guys, right? And I remember when I, back in the early days of my jiu-jitsu journey, seeing a meme, and it was, I don't know the name of the character. The name of the show is Eastbound and Down.
Mm.
So is that actor? He's like a semi-pro baseball player. He's got a mullet, and he said, and the meme said, I know I don't do CrossFit. I do jiu-jitsu. And then it said, what do you do for cardio? It said, more jiu-jitsu.
More jiu-jitsu. Yeah.
Right. And and there was a school of thought, right, that like, what do you do for jiu-jitsu? What do you do to get in shape for jiu-jitsu? More jiu-jitsu. Right. Just keep doing jiu-jitsu.
Yeah.
No, that hour that you spent at the, lifting weights, no, that could have been an hour doing jiu-jitsu. And right. I actually at one point, I actually subscribed to that belief. And I realize now, especially as an older grappler, That's not the case.
It's not.
You have to have a comprehensive and science-based strength and conditioning routine. Because in order to maintain flexibility, strength, endurance, power, flexibility, mobility, and durability, you have to do all those using proper kinesthetic, proper ergonomically designed strength and conditioning exercises.
Yeah.
Because the thing about jiu-jitsu is, and everybody knows this, right? If I tell one guy, go, hey, lay on your back, I tell the other guy, hey, go get in side control. He's going to go get on that guy's right side.
Yeah.
Because that's what we always practice.
9 times out of 10. Yeah.
I'm in side control. I'm used to being top side control on my opponent's right side. I'm used to being top side control with my opponent on my right side, right? So what does that mean? That means we're extra, and that's just an isolated example, but that means anytime you're doing a jiu-jitsu move, you have a favorite side.
Yeah.
Right? We all have a side we call our dumb side.
Right.
So you're not working out your muscles evenly, which means your flexibility is not worked evenly, your mobility, durability, none of those things are worked out evenly. So that's where you're going to get injured. And hey, guess what? I'm right-handed. With the exception of my hip, all of my most serious injuries are on the left side of my body.
Yeah.
My left shoulder
not
sucks,
a coincidence.
my left hand sucks, my left knee sucks, right? It's all on the left side of my body.
Yeah.
So I have to do proper strength and conditioning for 5 sessions a week to maintain what I need for health as it comes to jiu-jitsu. So that's one thing. You can't just do jiu-jitsu.
I agree.
Right?
Yeah.
Jiu-jitsu is great. You can lose a lot of weight doing it, but if you're just doing jiu-jitsu to do sport jiu-jitsu and to lose some weight, and that's all the time you have, fine. If you want to be serious about your jiu-jitsu journey and you're in it for the longevity, even if you're in your 20s and 30s and feel like you don't need it, add the strength and conditioning now.
Yes.
That's what's going to prevent you in your 40s and 50s from having those debilitating injuries.
That's right.
To me, that's the first thing, and that's what I discovered on my own.
Yeah.
The next thing for me was a conversation that I had with John the Baptist himself, Professor John Danner, right? And I specifically asked him, and oddly enough, he misheard my question. He didn't answer the question that I actually asked, because I was actually asking him a question about neuroplasticity and about the difficulty learning as we get older. He misheard the question, but what he ended up giving me as a reply was probably even more important. And I'm clearing my throat because I have to do the Danaher impersonation.
Oh yeah, please do.
He said, Doc, the most important word in your training vocabulary is the word no. No to a training day when you're injured. No to an opponent who you feel may injure you in some way. No to a move that is just not something you're going to be able to accomplish. No is the single most important word in your training vocabulary.
If my eyes were closed, I thought I was actually on a podcast with John Danner.
With John Danner,
right now,
right?
Yeah.
And of course, while he's saying it, you're like, there's rays of sunshine.
Right.
And like I'm having a one-on-one conversation with John Danner. Like it's truly, he's just come out of the wilderness, still eating locusts, and he's giving me this information.
But that is such, it seems such like common sense advice, but common sense is not common.
Or tell you.
Yes, it's so true.
Yeah.
And almost every injury I've ever had almost is because I didn't take his advice.
Yeah.
It really is. Yeah, I have rolled with like super spazzy white and blue belts. That's how I blew my ACL, because they just were out of control and flailing around. And so, I've always had a target on me, just as a higher belted guy, and so they're coming after me, and especially these guys that are good college wrestlers, they want a piece of me all the time, and it's hard to say no to that. It's hard when this 22-year-old kid who's bouncing around, is like calling you out. and you have to sit there and say no. And I've had to do that lately. I'm about 8 weeks into rehabbing. I have another rotator cuff tear, my surgical shoulder. It's just now getting better, but it's really hard. It's been, I'm a guy just like everyone, all these other guys, and I still, in my mind, think that I'm 20 years old, but I'm not. And when I teach no-gi at night, I want to roll with my students. And when I go to noon class with the gi class, I want to roll with my buddies, and I have to say no, and it sucks. I freaking hate it. But if I don't, I'm gonna reset that clock. I'm gonna get re-injured, and I'm gonna be out another 8 to 10 weeks.
Yeah.
So it's and unfortunately, I've learned that the hard way. I think I'm pretty book smart, but I'm not very mat smart. Yeah. And because I've learned that.
What I've recently discovered is, in addition to that, the other no that I put in that is sometimes it's a no to matching their intensity.
Yes, great point.
So
I own that. I have a problem with that. I do. If they start,
we tend to mirror the level of intensity, right?
Yeah,
and we're like, I can show this guy. Like if I just dig a little bit deeper,
right,
I can show this guy, right?
Yeah.
I was in a situation, and this was at a class last week. I had I think he's 21, 22-year-old white belt who outweighs me by probably 75 pounds, 50 to 75 pounds. And I've rolled with him before. I can usually, pretty easy to reverse him. He's got to the point where he's kind of figured out how to use his weight,
his size,
not pressure, right? And we were doing specific training. We were doing side control specific training.
Yeah.
And I kind of kept him at bay for a while, kind of pushed him this way and off balanced him that way, and brought my knee back in, and brought my elbow in, and did this, did that, put him a little bit off balance, and he ended up just sprawling a lot of weight on me.
Yeah.
And I'm like, you know what? I could dig. I could grab his lapel, just really drive an elbow into his neck to get it up, and then just bridge really hard, get my knee up, and probably come around to guard. I might injure myself in the process, right? I might injure him in the process, right?
Yeah, absolutely.
Because I'm gonna have to literally throw all of my power behind it. I tapped to pressure. Probably the first time I've tapped pressure in 3 or 4 years.
Yeah.
And he goes, what did I do? And I go, no, I'm tapping. Your pressure's awesome, man. I'm tapping to pressure.
Yeah.
And the buzzer went off, and he was like, oh, shot. I was like, hey, good job.
Right.
I don't have an ego problem with that.
Yeah.
I tapped to a white belt. I didn't get a notification that my car insurance went up or that my credit score went down.
Yeah.
Because I'm a purple belt and I tapped to a white belt.
Yeah.
And I know that could I have fought out of that? Yeah. Might that have caused an injury that would inhibit me for years to come? Yeah. So would it have been worth it?
Yeah.
No. It's we all know that ego is your biggest enemy.
Absolutely. And your instinct is to fight out of that and be like, I'm not giving him the satisfaction of a tap.
Yeah.
And that's the sign of a mature jiu-jitsu athlete, I think, where you realize, hey, listen, this isn't worth me being out for 6 months potentially. Yeah. And who cares? We all tap. I get tapped, you tap, it's fine. It's not a big deal.
I'm actually more embarrassed that it took me this long to get to that.
So I am too, honestly. I mean, I feel I'm a knucklehead, and I think about all the wear and tear that I have, and I think at least 50% of it I probably could have avoided. But you learn the hard way, but you still learn. So
yeah, no, it's this finger looks the way that it does.
I got one of those too.
I think almost everybody
actually,
I know does.
It's this one actually.
Because I had a gi sleeve hold.
That's what happened to me.
That when I knew he was going to get aggressive about breaking the grip, I should have let go.
Yeah.
And I didn't. Yeah. I wanted. He was in my guard, and by God, I wanted that arm bar.
Yep.
I was going to get that arm bar.
Yep, you're going to get it.
I had that gi sleeve, and I was getting ready to come over to pull that elbow in. And I'm like, no, I'm going to get this. Snap! There went my finger.
Yeah. Yeah. you know, and that's just the way it goes. That's the way it goes. But I think that jujitsu is something that, just to circle back, I hope if there's someone out here watching this who's thinking about doing jujitsu, maybe you're over the age of 50 and you hear us talking about all this stuff, don't let that don't let that shy you away from trying this, because this is jujitsu is one of the most rewarding activities I think that a man can do. And as an older athlete, you can roll with the upper belts if you're brand new, and roll with brown belts and black belts who roll with control, and they're not going to hurt you. They're if you do get injured with them, it'll just be a freak accident. It'll be nobody's fault. But roll with upper belts. Many classes or many schools have over 40 only classes. Roy, when he had his gym here, we had an over 40 class, and it was great. It was just a bunch of guys like us, and yeah, we would still roll hard, but most of the class was perfecting technique, which is what we all need to be working on anyway. Or we would do what Roy Harris, Mr. Roy Harris would say is he'd say roll like grandpa on Valium. So just ridiculously exaggerate the slow movements so that you have perfect technique, and that's what we would do in these over 40 classes. And you can get really good at jiu-jitsu, and you can minimize risk by doing that. And so don't let us scare you away if you're worried that you're going to get hurt. Stuff happens, but at the same time, this is such a rewarding activity that I just encourage every guy to do it. And you never know, like it literally could save your life one day.
Yeah. And don't be afraid to tell your training partners where your injuries are.
Oh yeah, absolutely.
You're not going into an MMA fight. They're not going to go, oh, that's your bad knee, that's where I'm going to kick you.
Right.
Just the opposite. They're going to help you out. And I don't, one of the big critiques on most people doing jiu-jitsu, especially when it comes to sport jiu-jitsu, is, because for safety purposes, we start down, right? We start on our butts a lot, start on our knees. Right? And now that I'm as a purple belt, I feel obligated that I need to start standing a lot.
Yeah, right? Absolutely.
So I will start standing. I'll start standing with people that I know who are blue belt and above.
Mm-hmm.
Brand new. I made the mistake of starting standing with a trial class guy who had 4 years of wrestling under his belt.
Of course, yeah.
Blast double leg.
Right.
A little bit maliciously. I ended up making him pay for that. But it's because that I felt was malicious. But most of them, it's not because they're going to.
That's all he knows.
Yeah,
that's just those guys are one-trick ponies.
Yeah, but I try to start standing more and more. But if I'm rolling with somebody that I don't know,
mm-hmm.
or somebody that I roll with before that I know is a little bit of a loose cannon, I'll be like, no, man, don't. Yeah. This is out of respect. Because I respect your athleticism. Yeah. We're gonna start on our knees.
Yeah,
because I don't want you to hurt.
Eric Paulson has talked about this too, because he's getting up there in years, and he's he's a little woo from some of the interviews I've seen with him lately. But he talks about he can tell if somebody has bad energy, and he won't roll with them.
It's a weird way to say it, but
it's just his way of saying I can tell that you're not going to be in control.
Right.
And maybe you're here to tell somebody that you tapped Eric Paulson.
Right.
Yeah, which he doesn't need that at his stage in life. And so these gung ho guys that want to be in the UFC one day, it's okay to turn down a roll with those guys, or to just do specific training on one specific thing with them, and then let them turn them loose on the other 20-year-olds that are there, and you can just avoid that. So there's ways.
I've had 20-something-year-old blue belts beat up on me for.
Oh yeah, me too.
And when it's over, I smile and I shake their hand. I say, hey, I'm legitimately thankful.
Yeah.
Because they gave me things in that role.
Yeah.
That a 42-year-old brown belt is just not going to give me. right?
Yeah, absolutely.
That I'm not going to get.
Absolutely.
Another thing I think is really important is not underestimating your recovery phase. This week I've been meaning to add a third day back. It's been really difficult with my schedule, so I'm hoping I can add it back this week. But my 3 days in a row. I haven't done. I did 5 days in a row rolling. I think it was before. I think it was right before my hip surgery.
Yeah, that's tough. That's tough on the body.
Yeah, and I was doing strength and I did 5 days in a row rolling and doing strength and conditioning. So 2 days. I just wanted to see what my body would react, and it kicked my ass. It really did.
Oh, for sure.
When I teach courses for Code 4 concepts or effective fitness combatives, I'm rolling every day for 4 days in a row. But it's we do usually we do rounds at lunch, and it's demo throughout the rest of the day.
Yeah.
So, depending on how intense I get, I'll get pretty beat up. But what I try to do is if I decide that I want to train multiple days in a row, I fluctuate my intensity.
You have to. Yeah, you have to have heavy days or hard days and light days.
Yeah, just like strength and conditioning, right? You can't, you're not going in to do PRs or going in to do a crazy Tabata 5 days in a row, right? You're doing different things on different days. And varying that intensity is really important because the thing that is, in my opinion, that is most affected by age is not necessarily output but recovery.
That's precisely right. Yeah, you can still perform.
Yeah,
you can still perform. I'm still pretty strong in the gym, but those the recovery days, they're super important. And getting back to what you were saying before, with stuff outside of the gym, your nutrition has to be good. The sleep has to be good. All the stuff that we should be doing, it needs to be good. Otherwise, you're going to add extra recovery time. If those things are not dialed in, well, now you've got an extra day of recovery because you were out late with the boys drinking beer, or maybe you're up late, I don't know, playing video games or something stupid like that.
And think of it this way. Sometimes you have to make a choice between choosing a day to recover or now I'm going to take a month to recover because I pushed it.
Right.
Yeah. But like you said, you can still perform. It's like we just lost Toby Keith, God rest him. He famously said, "I'm not as good as I once was, but I'm as good once as I ever was."
Yeah, exactly.
I can do it. I can do it. You might have to carry me home afterwards. But
I think that pretty much sums up my jiu-jitsu game right there.
Yeah.
At this stage, pretty much. Yeah, I got one really good round. So, well, cool, Mike, dude.
You do one good round a night and 4 flow rolls.
Yeah.
You work on being very technical.
These days, I mean, it's I'm a new dad now. I've got to practice. I'm still cranking out shifts in the ER. So if I can hit that 3 days a week stretch, which is kind of my sweet spot now, 2 of those might be hard days and then 1 light day, but more often than not, it's 2 light days and 1 hard day only.
Yeah.
That's just the way it is. But that's okay. Yeah. I mean, I appreciate the lighter days now and the technique. And I'm sure you see this now as you're getting close to your brown belt. You learn a lot of jiu-jitsu by teaching jiu-jitsu to other people. Mm-hmm. It's that, like in Residency, that old like see one, do one, teach one, that's the cycle you have to go through to master something.
Yeah.
And I spend a lot of my time now teaching classes and less time rolling, but it still keeps your mind fresh. People will ask you questions. You're like, wow, I didn't really think about that, about certain moves that you might be teaching. And so there are ways to continue to progress that don't involve you necessarily like hitting it hard on the mat every single day. Just teaching white and blue belt stuff is really useful, I think.
Yeah. No, it absolutely is. It makes you go back and really concentrate on the basics again.
Yeah.
And for a while as a purple belt, I was going to the basic class just because I kind of wanted to reinvigorate all those basics. Whether it was basic, where's my left hand go on a flower shape? All these little things that you kind of can lose over time, or that we take for granted.
Yeah.
So I got one of the such a high compliment. I was an assistant instructor for the Effective Fitness Combatives program here in Austin a few weeks back. We had 56 law enforcement officers come to the course, and Jay, I think Jay taught basically he taught the basic scissor sweep, right?
Yeah.
So he showed he demonstrated the basic scissor sweep, and a lot of them were drilling. I noticed a lot of them were having problems. I said, hey Jay, I said, do you mind if I show them just a little thing to debug it? Brought everybody back to the center, and I just showed them a couple of things. Basically, it was all about head placement.
Yeah.
If you set up for your scissor sweep. Don't look here. Look here, right? Look, stretch your body out. Look at the far wall.
Exactly. Yeah, exactly.
Halo, right? And I showed them this, and I got up and I walked off the mat, and they were continuing to drill. And Jeff Mullinex, who's a kick-ass black belt, he pulled me aside. He goes, "You're a fucking wizard." And I'm like, dude, he goes, "Dude, I'm a black belt. Nobody's ever told me that."
Yeah.
And I was like, "Oh shit!" And it's anytime I learn something in a video, or if I go to class outside my normal school, if I go to a Danaher class, the first thing I do when I get back to my regular class is I'll grab somebody during warm-ups. I go, "Hey man, can I show you something I just learned?" And this helps me three ways. Number one, it helps me debug and make sure that I still know it. Number two, I'm verbalizing it. So like you said, it's really solidifying in your neural pathways, right? That you're doing it, right? And I'm getting feedback from them.
Exactly.
Yeah, well, I feel like I could do this, or I feel like I can't do that.
Yeah.
And the third way that it helps me is I'm teaching it to them as well. So now I have to learn how to defend it because they know it.
They know it. Yeah.
Right?
Yeah.
Because I want the guys in my gym to know everything. So when I go out and have to fight somebody for real, I don't ever see something that I'm surprised by.
Exactly. Yeah. Yeah. I always said my goal was I want to be a black belt at white belt jiu-jitsu.
Yeah.
And that's my game. I know a few fancy tricks that I have just for fun, but really it's just white belt jiu-jitsu, just really good and efficient at white belt jiu-jitsu. That's all you need. And you can go, you can win worlds with that.
Yeah. To this day, Americana,
Kimura,
head and arm triangle, Kimura, and paper cutter chokes. That's probably 95% of what I've submitted.
There you go.
Since I've been doing it.
Yeah.
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 I can count the number of times I've triangled people on one hand.
Yeah, mine don't. That's not a strong part of my game. It's there, but it's not a go-to. Nobody's afraid of it. Let's put it that way. Yeah. Nobody's afraid of Andrew's triangle choke. So, well, Mike, dude, it's been awesome having you on to talk about this kind of stuff. So, and I'll leave you this. What's the best thing what's the main thing you've gotten out of jiu-jitsu? The biggest, if you have one thing you could say. I don't mean to put you on the spot.
No. It's and I've verbalized this before, so luckily I was prepared for this. Is the great thing about jiu-jitsu is the thing that you learn from jiu-jitsu that you can extrapolate to life. I talked about it earlier. I've got that guy who outweighs me by 75 pounds. I'm on my back on the ground. He's laying on top of me, right? If I can be calm and comfortable in a bad situation where every cell in my body is telling me you're going to die if you don't get out of this.
Yes.
If you can be calm in that situation, then shit that life throws at you seems mundane in comparison.
You just said the exact same thing I was going to say. It's exactly right.
Steal it from you.
No, but it's true.
Be uncomfortable. Be comfortable being uncomfortable.
And I'll end with this final little caveat to that is jiu-jitsu has made me a better emergency medicine physician, because when the shit is hitting the fan in the trauma bay, it's the same sort of thing. There is a tremendous amount. It's not physical pressure on you, but you have the pressure of a dying individual in front of you, and you need to be calm. You need to use proper technique, and you need to do things methodically, and that's how you escape that situation. Just like that's how you escape side control with a 300-pound gorilla. who's trying to, smash your lungs out. It's the same idea. It's take a big deep breath, remain calm, and do what you need to do to get yourself out of that situation. And then
Yeah.
it becomes easy.
And prioritize the problems you want to solve.
And prioritize problems. Exactly.
Yeah. It's, okay, I need to get my underhook. I need to turn into him. I need to get the base.
Yeah. It's the same as I need to take the airway. Okay, I need to put in a chest tube. Now I need, I need a central line. I need blood. It's the same thing when you're resuscitating somebody who's critically ill. So it spills over, man. It's everything. Jiu-jitsu is life.
Jiu-jitsu is life.
Yeah. All right, brother. Thanks so much.
Thank you, brother.
All right.
All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.